Good morning or afternoon to you, depending on your time zone. I'm Judy O'Kelly. I'm the Chief Program Officer for the National LGBTQ Plus Bar Association. I am so glad to be welcoming all of you to our webinar. We are holding this webinar today in honor of World AIDS Day 2025, and the title of our program today is HIV Prevention Today, New Threats and Opportunities. It's good to be with all of you and to have such a strong turnout for this important discussion. We have a truly extraordinary panel of experts from different professional fields who are giving of themselves to be with us today to help this predominantly legal community that we at the bar connect with to learn more about the challenges that are facing the work of HIV prevention in 2025 and as we're heading into 2026. So thanks to everybody for being here. I want to let everyone know that we at the bar will be holding a day of HIV topic programming at next year's Lavender Law Conference and Career Fair. That's going to be running from July 13th to 15th in Chicago. We hope to see you all there, and you can learn more about that at lavenderlaw.org. So I'm going to kick us off today by introducing our outstanding facilitator, Elizabeth Kaplan, and then I will drop off and let her take it away. Liz Kaplan is the Director of Healthcare Access for Harvard Law School Center for Health Law and Policy Innovation, and she's a clinical instructor with the Harvard Law Health Law and Policy Clinic. Liz focuses on issues impacting access to care and prevention for HIV, hepatitis C, and other chronic and complex conditions. She previously worked as an assistant attorney general for Massachusetts then Attorney General Maura Healey. She also has experience working in a medical legal partnership where she provided direct legal services to low-income clients with chronic conditions such as HIV and mental illness, addressing legal issues related to Medicare, Medicaid, and the rollout of the ACA. Liz has a JD from Berkeley Law and is a member of the Massachusetts Bar. Liz, thanks so much for being here, and I will let you take it away. Thank you.
Thanks, Judy. And thank you to the LGBTQ Plus Bar Association for holding this event on this day, the 38th Annual World AIDS Day. More than 40 years into the HIV epidemic, we're sitting at a juncture where so much has been accomplished nationally and globally in the fight against HIV, including increasingly diverse, sophisticated, and easy to tolerate HIV treatment regimens, highly effective tools to prevent transmission, such as long-acting injectable PrEP, and the knowledge that those with undetectable HIV cannot transmit it, and awareness that ending the HIV epidemic requires a commitment to empowering and meeting the needs of those most impacted, including LGBTQ plus communities. Simultaneously, we're in a time of massive disruption to efforts to end HIV, including through funding cuts, state-sponsored discrimination, and undermining of our national and global institutions that support treatment and prevention. And so I think that the World AIDS Day 2025 theme is apt. We need to rethink, rebuild, and rise to meet the current challenges. And we'll be talking about that today in the context of domestic HIV prevention. I'm really excited to be joined by some of my colleagues and partners in this work. Michael Elizabeth is the Director of Public Health Policy at the Equality Federation, where they mobilize state partner organizations to influence policy with a focus on HIV and other health issues that disproportionately affect the LGBTQ plus communities. They have more than a decade of experience rooted in LGBTQ plus political and community organizing, including as former president of the Houston LGBTQ plus Political Caucus. Jose Abrigo is the HIV project director at Lambda Legal Defense and Education Fund, where he oversees the organization's impact litigation and policy advocacy related to HIV at the state and national levels. Previously, he directed HIV and LGBTQ advocacy at Legal Services NYC's Manhattan Legal Services, the largest direct legal services provider to people with HIV and LGBTQ individuals in the nation. And finally, Carl Schmidt has over 25 years of experience in national HIV policy and advocacy, including having served as co-chair of the President's Advisory Council on HIV/AIDS, PACHA. He is now the executive director of HIV and Hepatitis Policy Institute, which promotes quality and affordable healthcare for people living with or at risk of HIV, hepatitis, and other serious and chronic health conditions. So I thought we could kick off today by focusing on, or starting off with, what are some of the key legal and policy threats to HIV prevention access that you are focusing on currently? And maybe Jose can kick us off.
Thank you so much, Liz. So I think right now the biggest legal threat to HIV prevention access is the attack on the United States Preventive Services Task Force and its independence. So taking a step back, there are three expert bodies in the United States government that mandate which preventative services must be provided at no cost by insurance. They are ACIP, HRSA, and the biggest is the U.S. Preventative Services Task Force. The U.S. Preventative Services Task Force recommendation is what makes PrEP, which is not to overstate it, but it's a miracle drug that reduces the chances of HIV transmission to almost zero. It basically makes PrEP a guaranteed no-cost sharing benefit that insurance must provide. So one of the very few SCOTUS decisions that was a bright spot last year was Kennedy versus Braidwood. That's where the justices upheld the basic structure of the preventative services in the United States. Liz and I are very familiar with the Braidwood case. We worked behind the scenes to support the remaining Biden attorney generals on that case. But so while the decision upheld the structure of the task force and their recommendations, it also left some other issues unresolved, and it also made it really explicit that the Secretary of Health and Human Services right now, RFK, has greater control over the task force. So right now, the task force is at threat. We know just a few months ago, RFK fired all of ACIP. ACIP is the advisory body that determines which immunizations have to be covered by insurance at no cost. And we know that he's making more moves to take control of the task force. So if the task force recommendation for PrEP is overturned, in practice, that will make PrEP become sort of a luxury good. It's something that people with means can afford, while those most impacted by HIV, mainly Black communities, LGB communities, and trans communities, will be locked out of being able to afford PrEP because now it will no longer be at no cost. And that's exactly the point of these attacks. It's to shrink access, shrink government, shrinking science, and shrinking the rights of communities most impacted by HIV. And as Liz alluded to, in parallel, we're also seeing a rapid dismantling of the federal HIV infrastructure. Carl and Michael Elizabeth will speak more about this, but I just want to highlight a specific aspect that's of particular interest to attorneys, in that most of the direct services funding for people living with HIV come from two pots. LSC, which provides civil legal services to the entire United States, and Ryan White, which provides specific HIV-related direct legal services. Both of those funds currently are a threat of funding by Congress. These fund most of the major HIV legal providers in the country. So cuts to these programs, the administration's restrictions on DEI, and all these various executive orders threaten the ability of vulnerable people to navigate the system that connect them to HIV prevention and care. So together, these attacks sort of create a perfect storm. It narrows the rights to preventative health care and removing the supportive structures of people that actually use those supportive structures to prevent and maintain HIV care.
Thanks, Jose. And I think, Carl, I'll go to you next, because I think some of what you're working on rather will kind of build on what Jose has already highlighted for us.
Yeah, so the biggest threat that we're seeing has really been, as Jose has talked about, an attack on HIV prevention domestically. We see it globally as well. But this administration, since day one, has gone after the CDC. It seems that's like a retribution for its work on COVID, is what they're saying, and that they fail the U.S. People and the public health system. And so we're being blamed, and and HIV is probably one of the largest pots of funding at the CDC. And so it's a target. And, since day one with the executive orders attacking immigrants, certain communities, particularly transgender community, and then going after the staff and, remember Doge? And well, they really zeroed in on the HIV staff. Fortunately, because of the outcry from the community, some of them were brought back. We lost our leadership as well, and we still don't have leadership and communication with the CDC. And then, and they've really been stymied on what they can do. And then, came the budget. And well, and the money, even the money that was allocated wasn't able to be spent. And again, it was outcry by the community and the state health departments to get that money out the door. And but in the meanwhile, a lot of staff in the field were let go, and a lot of uncertainty. And I have to say, there's still a lot of uncertainty because of the president's budget proposed to eliminate around $800 million of domestic HIV funding. And then the House went further and they voted to eliminate all $1 billion of domestic HIV funding. Now, the good news is the Senate has, in a bipartisan way, has maintained the current level. But we are in limbo right now between the House and the Senate. People don't know what's going to happen. Great uncertainty out there. The staff at the CDC doesn't know what to do. They don't know what their future is. So that's where we are right now. But just to remind people what that goes for, it goes for testing, it goes for surveillance, it goes for outreach. A lot of people think, CDC prevention. Well, they also do a lot of work in treatment as well, because when you test, positive, you're linked to treatment. And also they do a lot of adherence work as well. This webinar is titled Threats and Opportunities. And at the same time, as Jose said, we have this great opportunity in the area of prevention because of PrEP. We've had daily oral, we've had once every 2 months, and now we have once every 6 months. And who knows, it may be once a year, we may have once a month oral soon. But the great thing is, as Jose said, that private insurers should be covering these PrEP drugs free of cost sharing, and also, at least for the first 3 that were approved, no prior authorization. Unfortunately, we're seeing a lot of private insurers, employers, still charging people cost sharing or putting prior authorization on. So we need enforcement by the federal government. And also we need some direction about, as new drugs come onto market, are they covered by the existing U.S. Preventive Service Task Force? Or do we need another recommendation? We feel in my organization that we don't need another recommendation. PrEP is already got a grade A. So, and those are the people who are insured. But what about all the people who are uninsured? And even if I have insurance, I think it's important to do the outreach. And not only to providers, but to communities, particularly communities that are mostly impacted by HIV. And they need the outreach and the education. And right now, that's all on hold right now.
Thanks, Carl. Mike, do you want to sort of take us to the state policy side?
Absolutely. Just building off of quickly what Jose and Carl just elaborated on. Right now, the biggest threats to HIV prevention that come from the state level also, by the way, includes the large cuts that are happening on a federal level to healthcare programs that too many of us rely on. One of the things that we immediately realize is a lot of folks don't know where their healthcare comes from. And this is a quote directly stolen from Carl from AIDS United, the new CEO and president of AIDS United. Essentially, what states are preparing to do is making it harder for people to keep their health insurance, especially insurance programs for low-income communities. As is already discussed, states are preparing for new rules requiring constant paperwork or proof of employment, and many people will lose coverage simply because they can't keep up with the process. And so, yes, that's a federal development, but a lot of these federal developments have real state level impacts that oftentimes don't get as uplifted to the degree that we want to. We're also seeing a greater passing of laws, not just on a state level, but even baking into federal policies and appropriations around restricting healthcare for transgender people. Oftentimes, folks consider transgender healthcare as separate from HIV prevention healthcare, but the data doesn't support that, as we know. The data shows that those of us who have trans experience are more likely to be adherent to prevention care if we get access to our gender affirming needs. And so for so many of our communities, transgender healthcare is directly tied to HIV prevention, if not HIV treatment as well. We're also seeing many clinics preemptively stop offering almost any services for LGBT, they're considered LGBTQ services that can include HIV testing or PrEP in some cases as well. We're seeing a greater spike in introducing bills that increase penalties around HIV or allows for HIV testing without consent. These kind of laws scare people away from testing and from other preventive services like PrEP, which is the opposite of what public health services and communication is responsible for. At the national level, as we just explained, these funding cuts to HIV programs and community health centers prevent local initiatives, meaning fewer places are offering testing and treatment and medications like PrEP. We're seeing this happen in Virginia as a strong case in point, where it's a double hit, where the Ryan White funding is being cut by almost 50% for most of the state, which, of course, as we know, treatment as prevention will impact folks' ability to stay HIV negative. We're seeing LGBTQ plus legal clinics are losing grants that they depended on to help people fight discrimination, navigate health insurance, or access vital medications. According to Centerlink, nearly 2/3 of LGBTQ community centers receive at least one federal grant or state or local government grant, totaling over $117 million. Equality for Asian state partners are at risk of losing over $2,743,000 because a lot of our state partners are recipients of the Victims of Crime Act program funding, or VOCA program funding. And as you may know, that's now been considered DEI, categorized as DEI, and therefore a lot of our centers that protect, access to these services that prevent new transmissions are also under threat. And so it's a combination of things. The bottom line essentially is the combined cuts make it harder for people to stay insured, get tested, or stay connected to HIV care. And LGBTQ communities, especially Black, Brown, and transgender and low-income folks, feel the impact first and will likely feel the impact the hardest.
Thanks, Mike. I think you alluded to this, and then there was a comment/question in the chat that I want to uplift, to the effect that attacks on health insurance are also by their nature attacks on HIV prevention. So that includes the national Medicaid cuts, the largest cuts that we've seen to the Medicaid program in its history, as well as the fight that's currently happening over the enhanced premium tax credits for ACA plans that have expired currently, and that will effectively become an insurance cut for millions of folks across the country who can't afford to pay the increased premiums that they're being charged.
And I see the question in the chat. There's another question later in the conversation that will answer that as well.
Yeah. Mike, I think you started to speak to this somewhat, but I would love it if any of you could sort of further elaborate on how you see attacks on LGBTQ plus communities, especially the current political attacks on people who are transgender, as intersecting with the threats to effective HIV prevention.
So I'm litigating a case right now that I two cases right now that I think really speak squarely on this issue. San Francisco AIDS Foundation versus Trump and National Urban League versus Trump. There, I'm challenging three executive orders, two anti-DEI executive orders, and the gender ideology executive order. Basically, the DEI executive orders say that DEI is reverse racism, and the gender ideology executive order says that trans people do not exist. It's very clear that the administration conflates LGBT and HIV together. And so an attack on one group is an attack on one. It's all about removing and further disenfranchising groups who are most affected by HIV. So as Carl and Mike raised up earlier, the same, as far as trans issues go, the same ideology that's banning gender affirming care. It's an ideology that prioritizes moral panic and ideology over science, and also drives efforts to dismantle HIV care and HIV prevention, and basically the public health infrastructure. I completely agree with Carl that when COVID happened, the HIV model was how the basis that the government used to model their response to COVID. And as a result, the Trump administration is sort of taking its COVID grudges against the CDC. So, trans women, and especially Black and Latina trans women, experience some of the highest HIV rates in the country. When a state bans gender affirming care or shuts down the abilities of clinics to openly talk about sexual health, to openly acknowledge that HIV disproportionately affects communities of color, it's not just targeting trans identity, it's targeting the most effective HIV prevention strategies we have. How can HIV clinics continue to serve the community most effectively if they cannot talk about race, if they cannot acknowledge the existence of trans people? These attacks create an enormous distrust. When a trans person sees that their healthcare is criminalized or erased, why would they trust the same system that would protect their sexual health or HIV status? So the main thing is a conflation of identities, and the efforts to disenfranchise these identities. I don't know if they view it as a disenfranchisement rather than just defunding, but the intersections of trans health and HIV health, as Michael Elizabeth pointed out, are very connected. And just to speak separately on one issue that's coming up, our oral arguments for Lambda Legal's BJP case and ACLU's Hecox case has just been scheduled for January 13th. So if you're in DC on January 13th, there will be a rally on the steps of the Supreme Court. Basically, those cases will decide whether it's a statutory interpretation of Title IX, whether it protects Title IX protects trans people in the context of education, and whether trans people are protected can be considered a category under the Equal Protection Clause of the United States. This is the other case. So both cases are going to be argued on January 13th. Both cases will have enormous effects on HIV care, HIV prevention, HIV infrastructure, because such a large part of the community is trans and is affected by these laws. So just to flag that.
So I don't think anyone can add more than Jose just did. I think you did a good job, but just to reiterate a couple points. Certain populations, the ones that are most impacted by HIV in the United States, are being erased. And they're not even collecting data on transgender people anymore, all erased. And also, they're not doing outreach on certain communities. So, we know who is most impacted by HIV in the United States. And so if you don't see yourself in those outreach, well, all the money for outreach was actually, erased. And the staff is still gone, unfortunately, at the CDC. It is just hard to get the work done. And HIV work is not easy. And it takes intensive outreach efforts, targeted. And I say, if we want to spend our money wisely, you want to go to where the epidemic is. So actually, you're going to spend more money by, just taking a rifle shot. And and it's going to cost us more money in the long run because we're going to have more infections as well, unfortunately.
Yeah, I just want to summarize because it's impossible to add more to what Jose and Carl already clarified, but the attacks on LGBTQ communities and the attacks on HIV prevention are definitely deeply connected, if not synonymous in some of the lawmakers' minds. They are coming from the same political movement and the same harmful belief systems, which is essentially that these are efforts to restrict bodily autonomy, whether it's gender-affirming care, abortion, or HIV treatment or prevention, all grow out of the same desire to control whose bodies are valued and whose lives are seen as worthy of protection.
I completely agree. You all said it really well. Jose, you alluded to this a little bit, but I have also been thinking a little bit about the attacks on science and evidence-based healthcare and how that shows up in the threats to HIV prevention. Would any of you like to sort of dig into that a little bit more?
I'll be glad to start. Everything that we do with HIV prevention, HIV treatment is based on science. And since it's a public health issue, we really rely on the federal government, particularly the CDC, the NIH, HRSA, the Ryan White program. And so it seems that there's been an attack on vaccines and they cause autism, or the list goes on and on. But there is also that there's just a lack of trust in what's coming out of our government officials, and it's not based on fact, it's not based on science, and so there's a lot of confusion out there. And you saw that some of the governors have gotten together and created their own like public health infrastructure to correct things and to provide some leadership and some stability out there. But this is not good. And I saw it when the CDC did come out in strong support of recommending the new PrEP regimen that once every 6 months, and they strongly recommended it. But they couldn't talk about some of the studies that the drug company carried out in support to prove that this drug was highly effective in preventing HIV. And that was one major study on the transgender community. And that was not even mentioned. They could not mention the transgender community in the guidance. They could only say this would be helpful to the populations that are who need it, I think. So there, again, an erasure of certain communities, but this does, impact, science and the implementation of the facts.
I completely agree with Carl. We are witnessing an unprecedented assault on science, both in how federal agencies are allowed to operate and how courts are evaluating scientific evidence. And this really has enormous consequences for HIV prevention. First, when evidence-based processes like the Preventative Services Task Force, or like Carl said, CDC, or other HIV, HHS advisory committees are politicized or stripped of authority, we lose nationwide consistency in HIV prevention standards. So because I'm speaking with lawyers, I just want to highlight another case. There's a growing national trend to shrink the government, to not rely on experts anymore, and to basically have ideology drive our medical and scientific practices. There's a drive called the unitary executive theory. Braidwood was sort of the first step in that, and there's another Supreme Court case that's upcoming, which is Trump v. Slaughter, which concerns the independence of the Federal Trade Commission. That could potentially undermine Humphrey's executor, which is the foundational case that preserves the independence of executive agencies. So executive agents, the benefit of executive agencies and giving them some sort of independence is that it's experts, scientists, professionals who are making measured, reasonable decisions based on science and evidence. And here, if Humphrey's executor and the independence between the executive and federal agencies is stripped away, that could fundamentally undermine our whole national healthcare infrastructure because it politicizes everything. Gender affirming care is universally recognized as medically necessary care. The American Pediatric Association, the American Health Association, the vast majority of doctors believe it's medically necessary care. PrEP, HIV prevention, medically necessary care that people need to obtain. But because the government and medicine has becoming more and more politicized, it's a real threat by this administration. So the attacks on science, the attacks on the independence, on scientific independence, the defunding of research and this expertise and independence is really undermining our efforts to fund and prevent HIV. Previously, we had the ending the HIV epidemic, which had the ambitious goal of ending the HIV epidemic by 2030. That's completely cut off from the current congressional budget. So science is really a threat, and the expertise and independence of agencies is at serious risk as a result of this concentration of executive power more and more in the hands of this president.
I mean, I could just quickly add on that we are living in a moment where science is being treated as optional, as Jose just very clearly said, and that affects every part of HIV prevention. As Carl mentioned earlier, like the entire scientific infrastructure is being dismantled. Federal agencies for HIV research and prevention are being downsized, reorganized, or completely shut down. And research studies on HIV or youth mental health or substance use and LGBTQ health are being canceled midstream, removing knowledge that we depend on. My work in the HIV field started with a PrEP access study that was studying how PrEP would work in the real world, specifically amongst Black LGBTQ community members. And that type of research not only is not available anymore to build prevention programs off of, but is not being prioritized for future prevention implementation efforts. Their entire way that we even do HIV testing that includes sexual health counseling and conversations is based off of research that's now no longer available or no longer being prioritized for future implementation. And so this is actually dismantling how we can not just currently prioritize HIV prevention, but even prioritize HIV prevention in tomorrow or next year beyond this administration's scope of existence. I'm trying to be as nonpartisan as possible. But in addition to all the federal websites that has removed LGBTQ health information like HIV pages and STI resources, we're also seeing surveys that track health disparities have cut questions about sexual orientation and gender identities. Without this data, communities become invisible, and invisible communities are easy to defund and or ignore. And so the same ideology that says trans people should not have medically necessary care is the same ideology that says HIV is someone's fault and not a public responsibility. Both come from the same belief that certain people's health does not matter. And data used to help us prevent this argument and focus on the humanity and the facts of how we can address this crisis. And they're removing one of our biggest weapons against HIV that we have currently.
So I know we could talk a long, long time about the threats because there are many, but I want to transition us to talking about what folks can do to push back against these threats. So I'm wondering if each of you could highlight some strategies that attorneys or other advocates can use to push back.
I could go ahead, Liz, because this is what I do every day. Well, I guess we all do this every single day. But if you can't tell, I'm not a lawyer, but I'm a policy advocate in DC. And I think this is what we've been doing. And I hope we've been somewhat successful. But first, I think we've used the media. a lot. And, so I think that's been really, really helpful. If I'm looking at Jose and Liz, I mean, I think the media was helpful in the Braidwood case. And, the American people really relied on preventive services. And it's just not HIV and PrEP, it's a lot of other preventive services as well that was under attack. And thank God we won that. But I think using the media has been helpful not only in DC, but also around the country as well, in the high incident states, in the Republican states, in the southern states. And this is going to hurt the lack of 90% of the HIV prevention dollars go to state and local health departments. And if they don't have that money, they're not going to be able to function. So and it's again, as I said earlier, it's going to cost us more money in the long run as well. So I think those are good points. And the media, I think, is very interested still, despite it being World AIDS Day today, and we probably don't get as much attention as we did last year or the year before. And the Trump administration is not acknowledging it today because it is a WHO day, which is really unfortunate. But so media is one thing. Number two, working with the Congress, and that's where we've been, pushing back. And as I said, we do have bipartisan support in the Senate to maintain this funding. It's unfortunate that the House, in addition to cutting all HIV prevention, they took a 20% cut to the Ryan White program, which is direct care and treatment. But, hopefully in the end, we will, the Senate will prevail. But, taking our case again to Southern lawmakers, generating the media in those districts to get the members of Congress to react has been part of the plan as well. But we're trying to do as many congressional visits as possible, and including local constituents as well. And finally, you may find this surprising, but we have to work with the administration as well. And, again, the title of this webinar, there's opportunities in there. Well, Jay Bhattacharya, who is the director of the NIH, has ending HIV with a focus on long-acting prevention and treatment as one of his priorities, using implementation science. Well, NIH does not do treatment. NIH does not do prevention. NIH doesn't do testing, but we have an opportunity there. And I've had some conversations with people in the administration, and even today, even the White House, had to respond. And they said that they, want to end HIV in the United States and do prevention and do treatment and talk about viral suppression. So I think, maybe, I know DOGE went way too far and didn't, and I think everyone recognizes that in all different areas. But hopefully that we can work with the administration as the days progress. But I think we have to take advantage of some of the opportunities there.
Just to build off what Carl said, advocates are really responding on multiple fronts because the attacks are coming from multiple different directions. I mean, legally, litigation remains a critical tool. Sometimes it's the only tool because it seems like the judiciary is the only branch of government willing to check executive power right now. To stop unlawful restrictions before they become irreversible harms. We've used First Amendment claims, constitutional claims, statutory claims to protect access to HIV prevention and to HIV services generally. And courts have been essential in restoring evidence-based decision-making when agencies try to replace it with ideology. Apart from impact litigation, most of my career has been doing direct services for people living with HIV. And I think what attorneys and law students can do is enormous, and to keep people stable, to keep people housed. There's so many specific federal programs that require a level of expertise by HIV advocates, like the HOPWA program, or Ryan White, or ADAP, that require specific legal expertise that a lot of general legal services providers don't have, and that HIV service providers can do. One example in the prevention arena is filing appeals of denials of insurance. So if someone is denied PrEP by their insurance company, there's an administrative process. It's not overly burdensome. It's very easy for attorneys or for law students to engage in. It's an internal appeals process to overcome that denial of PrEP. Because remember, PrEP, for now at least, remains cost-free. And as Carl and as Michael Elizabeth pointed out, not a lot of insurance providers are following that mandate. So our job as attorneys and advocates is to make sure that insurers follow the law, ensure that PrEP is cost-free. And a lot of the services I provided as a direct services provider was the social determinants of health, basic housing. Someone is not going to adhere to their medical regimen if they are not stably housed, if they do not have access to steady food services through their benefits, if they do not have a steady income. So a lot of benefits advocacy is also very important in the HIV world. A lot of medical access advocacy is very important. Housing advocacy is very important. There's a whole subfield of housing law where there's a lot of rights attached to people living with HIV that really requires, specialized knowledge. And so this is to encourage up-and-coming lawyers and current lawyers to develop the tools necessary to serve the communities most directly impacted by HIV and to serve their basic needs and ensuring that they stay alive, that they stay connected to HIV medication and care, that they stay that they have access to affirming services, and to provide them the tools necessary. Attorneys can really, really help on the ground, help people navigate the labyrinthine process administrative arenas that it takes to be a low-income person of color living with HIV in the United States. It's a second job. And so keeping people stable, helping them litigate and navigate these legal fields is something that's crucially important for attorneys in this world. Last thing, because I always like to end on a happy note. I think Carl really raised the important point of the fact that the national narrative needs to change for trans care, for HIV care. I think as of right now, the national narrative is there's a conflation of HIV and LGBTQ folks. That needs to be broken down a bit more. There's sort of this conception that HIV is done, that the problem's over. The panic happened in the 80s and the 90s, and it's not a big issue today. There are 1 million people in the United States living with HIV and hundreds of millions more worldwide living with HIV. So it's crucial that we continue to support and fight for HIV advocacy. And I know right now I'm going to get political a little bit. It's been a really tough year. But one of the things that always keeps me hope is that we have advocates like everyone here on the call that's fighting to make sure that our community stays safe, that we have access to services, that we have access to whatever we need. We've existed outside of the law and the legal realm. Oftentimes we've been criminalized for the longest time, and we are still being criminalized for the longest time in certain states. But we have systems outside of the law to help keep each other alive and to help support one another. And that gives me hope for the future. And we are making headways and preventing the worst excesses of this administration.
Thanks, Jose. Michael, do you want to talk about ways people are pushing back in the States?
Yeah, and I think this is actually one of the more exciting, silver linings here, is because there are so many state level advocacy opportunities that, quite frankly, have been untapped until recently, due to our previous reliance and, quite frankly, dependability on the federal resources and institutions. For example, in 2023, Equality for Relation tracked over 200 state-level HIV-related bills throughout the United States, and 90% of those bills were good bills, and Like 80% of those bills did not pass those legislative sessions that year not because of opposition, but because there weren't engagement on them. And if you're familiar with state level legislative engagement, it's very similar to federal engagement. Lawmakers prioritize what they hear from their constituents during lead sessions. And if they're not hearing from the constituents about the importance of certain bills, they might not advocate as hard for hearings, et cetera. I do want to piggyback or build off of what Carl said earlier around the importance of media. I am going to send it to the LGBTQ Bar Association. The HIV Media Guidance Equality Fed came up with. On a federal level, this is not as much of an issue, but we have noticed on a state level and local level is that oftentimes the media don't have updated understandings of HIV and can unintentionally recycle the stigma that we're trying to fight around HIV. And so we created this guidance document mostly for local media that can be used as a tool whenever you're communicating with your local or statewide media outlets. In many states, advocates are pushing for new laws that protect access to HIV prevention, that expands pharmacy authorities to new prevention tools and protect PrEP access or remove outdated criminalization laws that could prevent folks from, taking advantage of HIV testing and knowing your status. In some states, communities have won major victories like modernizing HIV criminalization laws in Maryland or expanding access to PrEP through pharmacies in tough states like Louisiana. Equality Federation has a cohort of like 4 or 5 states where we're helping pass and implement pharmacy-based PrEP access, which is critical now as federal restrictions undermine medical access in general. And we're using this as a tool to investigate how can we even enhance access to gender-affirming hormone therapies through community pharmacies as well. We're seeing momentum build on how can we pass state-level opt-out HIV testing legislation in bills. Like, for example, in Texas, Representative Vinton Jones, one of the first Black queer people living with HIV that was elected to a state legislature in the United States, has made some real progress around passing their opt-out HIV testing bill in Texas, which most people assume that HIV testing is part of your regular screening criteria and access points. In many states, like in Texas, it's not. You have to specifically ask to be tested for HIV testing. And this gives folks the opportunities to be offered in your regular testing packages and screening processes. However, you can opt out if you do not wish to receive that HIV test. And it does come with informed consent. And we're also attempting to codify on a state level, where it's applicable, no cost sharing for preventive services currently protected by USPSTF. And so ways that folks can help we're going to get into that later. But anyways, and so these are some quick, policy level ways that folks are mobilizing. I will say, though, in general, this is not specific to states. There are some examples that are great examples to follow, like Georgia, Texas, Maryland, Nevada, Virginia. But in most states, the HIV advocacy infrastructure is not as resourced or built out yet. And so there is opportunities to help enhance the not just the expertise in local state organizing, but also the leveraging abilities. Like, for example, we oftentimes lean on Carl's genius and Jose's genius when it comes to like legal advocacy opportunities. Like Jose just pitched in Virginia, for example. And that type of relationship triage is not as prevalent on a state level in all 50 states as it is on a federal level. So there's opportunities to really blend expertise and our ability to leverage each other's strengths, if you will, on a state level, as we've seen being effective historically on a federal level.
Great. Thank you all. I want to make sure we have a few minutes for questions. I'm going to start with the question that came in about what's being done on a state and national level to prepare for the end of the ACA enhanced subsidies. I think I can answer that one pretty quickly, which is to say, you all, if you have not yet, should write to your members of Congress and tell them that extending these enhanced premium subsidies is critical. We have heard, Democrats were trying to hold out for this in demanding a solution before ending the government shutdown. That ultimately didn't happen, but they have at least been promised a vote on a bill of their choosing before the end of this Congress. But we have also heard anecdotally that members of Congress are not necessarily hearing as much from their constituents on this issue as they expected to. So I will drop in the chat a link to an action alert from AIDS United, where if you haven't yet, you can reach out to your members of Congress on this. And for those who don't know, this is a huge drop off in subsidies for those who have to pay out of pocket for ACA individual or small group plans on the federal marketplace or state-based marketplaces, an important source of health insurance coverage for people living with and vulnerable to HIV. Judy, was there one or two other questions that came in that you want to share with the panelists?
I think our main questions have been about direct legal services in New York City to volunteer with. And then, let's see, I see, thank you, Michael, one of our hosts, or sorry, one of our attendees has given us a HIV media guide that we can share. I'll put that over in chat.
Yeah, as far as pro bono opportunities, please connect with your pro bono. If you work for a law firm, please connect with your pro bono director. Alternatively, there are so many HIV services, direct services providers in New York City. Mine is Legal Services NYC. They have an amazing program where folks could do, I think in the context of HIV, most of our need there is immigration related, but then there's also name change. You can also help with name changes for people living with HIV. So that's legalservicesnyc.org. And then the other big one in New York City is the Legal Aid Society. They have HARP, the HIV/AIDS Representation Project. So those are the two big ones, but there's also GMHC, the Gay Men's Health Crisis in New York City. There is, what are the other ones? I will come up with a list and send over to Judy that she could share for volunteer opportunities, not just in New York City, but nationwide to volunteer to provide direct services for people living with HIV.
And I'll also just flag the center in New York as well. I do need to check to see what the status of their legal clinic is, because it was one of the clinics that was defunded recently. But they could use some additional pro bono support as well.
Getting lots of thanks in, but I think those are.
I think we had a question, a good question that came into the chat earlier for the panel. Do you think that the cancellation of programs and scientific research will come back once this administration ends? Or is this the new normal? Anybody want to?
How can anyone predict? But we are a resilient community and we will not stop. So we will continue to fight. I don't know who is going to be in the next administration, but we can't give up on this one. We have 3 more years, and we have the Congress as well. And there may be some changes in the Congress within a year. So let's not give up, and we have to continue to fight. But there's major disruptions right now. The dust is still settling. We don't know what the funding cycle is going to look like in a couple of months from now. And but we cannot accept the status quo. I know that.
I totally agree. I'm going to add to that I think it is a lot less likely to come back without us and without all of you. So we're going to have to continue this fight. We're going to have to, I think many of us on this call are certainly the speakers, but I'm hoping many of you also realize that the HIV epidemic is not over by any stretch. And there are many, many people and many communities that are not being reached in the way that they need and deserve to. And so more of this work needs to happen in order to get us back, even to where we were at the end of the Biden administration, I think.
Yeah, and I agree with everything that everyone said. I would also challenge all of us collectively that there should be a portion of our movement that is focusing on what is next after this administration. My dream world, if we had unlimited capacity and resources, is there is our own public health think tank out there that is prepared for when a new administration hits our land, what type of policies we can immediately start advocating for on day one. And so maybe there is a space that we can start curating if folks have the energy and capacity to be proactive around that. Because my personal belief, this living in the South for most of my life in a red state, that we're not going to have access to the level of resources and funding that we have grown accustomed to over the years, but we should be prepared to what does the new world look like? And what are the proposals for that? And what's the funding streams for that? And what that funding looks like for that? That, quite frankly, balances state level power and abilities to address this crisis as much as our federal abilities.
Thanks, Michael. Elizabeth, 100% agree with you. And I want to work with you at that think tank. I want to just finish us off. I know we have about 3 minutes left. If each of the panelists want to share one or two tops actions that lawyers and law students can take to improve or protect access to HIV prevention.
1, serve the HIV community through direct services. And 2, I'm going to steal probably what Carl's going to say, call Congress to make sure that the HIV infrastructure is kept in place and that Medicaid is fully funded, the ACA is funded, everything that folks rely on who are living with HIV in order to survive.
So ditto to what Jose said. Yes, speak up. We all have voices. And the direct service, I think, could be really, really helpful. As we all talked about, there's a lot of people that are still being charged for PrEP, and they shouldn't be. And, I am battling a major airline right now that is only covering generic PrEP. So if anyone wants to help patients, please reach out. Thank you.
Yeah, and I'm going to plug my own organization on things like, choose one state or one local organization and show up for them. That's it in my book. And what showing up can look differently depending on your ability and capacity, but it can mean volunteering for legal support for LGBTQ plus or HIV organizations that are losing funding or facing new legal requirements. A lot of times, the folks could use help reviewing harmful bills or write testimonies or prepare for legislative hearings on a state level, especially. A lot of our legislative champions don't really have staff themselves, especially on the House side or the delegate side of their states. Assist people living with HIV or transgender people who are losing health insurance, just like Carl said, or like being denied specific care that we know should be covered under health insurance. We already talked about this, but offering pro bono help to community clinics, especially when they need to understand new state laws or like what is being perceived as new federal regulations and requirements. And then this is where I plug my own organization, work with a state equality federation partner. We always need legal minds to help decode the next wave of bills or executive orders or whatever is going on these days. Just so FYI, most local organizations do not have lawyers on staff. Most don't have lobbyists. And many don't even have a policies person. And so the backbone of local and statewide HIV prevention and LGBTQ survival, quite frankly, rests on donated support and in-kind expertise. If every lawyer or law student paired with one organization, even for a few hours a month, we could protect more people, challenge more harmful laws, and prevent more HIV diagnosis.
I think that's a really great place for us to end. So thanks again to the National LGBTQ plus Bar Association for hosting this conversation. And thank you to the wonderful panelists for this afternoon's talk.
And thank you, Liz. Have a good day, everyone. Happy World AIDS Day.
Thank you, everyone.